Thank you all for joining us for our SICSS-Howard Mathematica Roundtable. Please enjoy this introduction to panelist and principal data scientist, Dr. Alex Bohl.
Hi everyone, my name is Alex Bohl, and thanks for taking the time to hear my story about how I got to work at Mathematica and my background. So I've been in Mathematica about 11 years, and I started out in industrial engineering. And I think that my background is epitomized by having a lot of different jobs. I had a lot of different internships and co-ops and student jobs ever since I've been an undergrad all the way through grad school. And that really set me up, I think, for success at Mathematica. As I started out as an industrial engineer, I had the opportunity to work first in manufacturing. I worked in dishwashing factory at General Electric. I worked in a call center and basically a scheduling center to release orders. And that really gave me exposure to automation and working with lots of different types of people and just trying to understand how the systems would come together. But there was a lot of data to basically organize and turn over the assembly line and make it more efficient, to how we release jobs and release orders and ship dishwashers across the country. And when I got back from that internship, I realized, well, I'd really like to do something else. So I did a little bit of work continuing manufacturing and bird feeders and other equipment manufacturing, but then I got launched into healthcare and public policy. I had two professors that gave me opportunities to work at hospitals and emergency departments, working with nurse researchers, clinician researchers, and it really gave me exposure to all the different types of data that they had at their fingertips to do different types of studies for quality improvement. And right around that time I graduated, it was right around the recession in 2007, so job opportunities were limited, so then I decided to go back to grad school. And I got a degree in a School of Public Health, focused on health services research. And when I got in there again, what defined, I think, me was that I had quarter by quarter jobs. I didn't have a fellowship at the time, so I had a lot of different student jobs working with professors doing research support. So again, I was kind of the data analytics person for these different clinicians or Ph.D. researchers. And I had a variety of different jobs working in this time in a health plan and working on their research wing, also working in a falls clinic, focusing on geriatrics, and then had a variety of different opportunities to work with jobs and teaching, and also going and learning about transition care and how different health systems were focusing on that hot topic of the day and trying to improve care transitions between settings. And so after I graduated, I found myself at Mathematica, where I've been for 11 years, as I said, and I really focus on a lot of different jobs, focus on quality improvement, quality of care, and value-based care. That kind of led me to a role in data science, where I could kind of bring together methods expertise, data expertise, and policy expertise. And over time, that role has really transitioned more into a client-facing role or a role overseeing teams of people. So I'm less involved with the day-to-day hands-on work these days and more overseeing teams, organizing teams, and so on. So my position now is being the director of data innovation, and the director of that means that I'm supporting the entire health unit, try to acquire data for different studies or different projects that we have. We use a lot of Medicare and Medicaid claims and enrollment data or administrative data. And so we work a lot exercising DUAs and finding staff who can work and that are experts in those data to align with different researchers, both in Mathematica and outside of Mathematica. And then I also continue to work on projects focused on quality of care and quality measurement. I lead a project that we've had for different iterations for roughly 10 years. I guess it's not the same project, but the same topic, at least for me, for 10 years. At the Agency for Healthcare Research and Quality, that pushes out a publicly available software called the ARC Quality Indicators that measures patient safety, and is using administrative data and is a free publicly available tool that's used in a variety of different applications. So what excites me about Mathematica? Well, I've been here for 11 years and I'm still really enjoying myself. What excites me is that there's a large variety of projects that you can work on, and if you can't necessarily work on them, you have colleagues that are working on them and you can learn through them. You're never really bored in that regard, because some of the most pressing policy topics of the day, for example, right now the Medicaid unwinding. Mathematica is brought into the fold. I'm not personally working on those projects, but I get to hear about other people working on it. It's exciting. It is stressful. It is a lot of hard work, but it's exciting because you know that you're on the forefront of important public policy. The other thing too is it's just a great place to work. You've seen the company grow and change over time. I happen to meet my wife here, so Mathematica is very personal to me. But I've met a lot of friends and a lot of colleagues, and of course some go, but more often than not they stay, and then new colleagues come in. So it's just been great to build relationships over time. And I think what excites me most in the current moment is, again, just focus on data. I think now are more poised than ever before to basically make use of all the data assets we have available to ourselves, to make apps, to do studies, to test out machine learning algorithms, all these exciting things. It really is kind of at our fingertips, which is really exciting. And in terms of my career trajectory, I talked about before Mathematica, but when I got to Mathematica, I started off as a researcher. So what that meant is I was really leading a task on a team. So let's say that I was on some large projects, so where there were multiple tasks, I led a team of 2 to 4, sometimes 6 people. And my role was to make sure that the task was completed. Typically, we were writing a report or delivering a data file or completing an analysis. So I would make sure that either I was writing specs for different programmers or different staff to do work, giving them directions. I was working with managers to set a schedule and think through resourcing. And then I was responsible for talking to the client, gaining experience and knowledge of the topic at hand if I didn't have it, and then oftentimes just moving that forward, solving problems along the way, and taking that to completion. So I started off as a task lead as a couple years, and then over time I got more exposure to proposals, the opportunity for us to win new work and bring on new projects, and so I started to gravitate toward that. And then after you work on a few proposals, of course, and you have some new projects where you typically take on more leadership. So I became a project director of 2 projects, one the quality indicators project I mentioned before, but then I also became a project director of a value-based care contract, which was called the Comprehensive Care for Joint Replacement Project. It's actually still going today. It was one of the first mandatory demonstrations that basically pays hospitals differently when they do perform hip or knee replacements, and that's always an ambitious health policy reform about 6 years ago, and it's still going and it's having some success. And so then after that, I led a few projects. I oversaw our data science team at Mathematica as a supervisor, where I oversaw recruiting, retention, and staff development, trying to maintain and grow the team over time, find good career opportunities for them. And now I've been focusing again more on this data acquisition, trying to work across the entire unit, all of our projects, all of our proposals, trying to source the best data possible and be as efficient as possible for our clients. So looking forward to sharing more of my experiences and answering more questions during our sessions together. Thanks.
Thank you all for watching. For more information on SICSS-Howard Mathematica, visit our website, follow us on social media, and join our email list.